deciding who gets infected and who doesn't get infected. There is something, I mean, it is very, very ambiguous to all of us on how fast this is spreading. That is one. Second thing is, earlier, I mean, I know a lot of people who, say these particular things. I've got both my vaccines, I'm not going to get infected, right? Then I know so many people who say, no, I have only stayed at home, I won't get infected. I am less than 30 years old, nothing is going to happen to me, I don't have any medical conditions, I'm going to be all right. Believe me, I have lost so many patients who were in these particular categories. We are losing children, not to a major degree, but yes, there are pediatric patients who have no other comorbidities. We are losing patients who have got both their vaccines, right? Forget about which, that's another debate, whether it is Covishield, I mean, Oxford, AstraZeneca, or Sinopharm. We are losing those patients as well. We are losing patients who have had no previous history of any other condition, and then, being admitted in the ICU, staying in the ICU for around 8-9 days, and passing away, right? So this is a very sad situation, right? So people, I mean, the reason I'm saying this is not to show you all that, okay, there's no hope. I mean there's no, I do not have any interest in doing this. I want to keep that optimism alive, but people need to take this very seriously. And as you know, Sri Lankans have this mentality. I hope I'm not offending anyone. We fast and we forget fast as well. And the initial reaction when we got the first wave, we reacted very promptly, and then everything disappeared. I mean, Delta could have, I mean, I'm not saying that it would have never come into play, but at least we could reduce the risk of progression. And there is a lockdown in play, right, where everything is locked down, but I still see people roaming around. So what's the point of the lockdown? I'm not, I mean, I'm not trying to go into any terms of this thing, but everyone has to look after themselves and do those necessary things to make sure we I mean, it's all about self-discipline, right? There is no need of a lockdown if everyone was, self-disciplined in making sure that they were doing the necessary things, like wearing your mask properly, wearing. I mean, I know so many people who wear the same mask. What's the point of wearing the same mask for around a week? There is no point, right? Cloth masks are not efficient. Wear a surgical mask and then change that surgical mask. Don't, I mean, I know it is a little expensive in that aspect, but again, it is about you considering the health of anyone else who's living with you. These are very, very important things, and I mean, people who actually understand the value of this are people who have had someone who, I mean, or known someone who has lost their life, or known someone who was in the ICU for around 20-25 days and got back and still crippled in any in the sense of quality of life. So there are a lot of aspects of this thing, and I think the most important message that I would want to actually say is, learn these principles. Self-discipline is very, very important, and I think that's the best way to reduce the progression of this disease. And I think the moment you realize that you're sick, take necessary precautions. Don't just wander around and go for a meeting because it's important. Get yourself checked, right? If it is, if it is suspicious. So all of these things you need to do, right? In Sri Lanka, the number we've recorded is not at all, I would say it's not even 30 or 40% correct to the actual number, because no one is getting themselves checked. Okay, if you don't want to get yourselves checked, I completely understand, speak to your doctor, but make sure that you do these particular things. You quarantine yourself so that you don't give it to someone else. We need to stop the lines. If more and more people keep getting infected, when does it stop? There's no way it's going to stop. So these are things that people need to consider. I mean, including myself, including people in my family, everyone. Every single person needs to think about it. I mean, I always wonder every time that I come into a contact with a patient, and I feel I am actually possible in going anywhere, and I mean, if I have a feeling that I had this positive exposure, even after being vaccinated, even after wearing a double mask, a face shield, and overall, I still sometimes question myself if it was enough to prevent me actually getting infected. And then I do take the necessary precautions even after having so many layers of barrier. So these are things that I think people should understand it. So I mean, there are so many things that you asked. There are so
Yeah,
many
just
things you asked.
just to interrupt you there. Now, I've seen like how much you cover yourself, how much layers and layers and layers of stuff you cover yourself. And you said that even after covering so much, you still have a chance of getting the virus. So,
Very, very possible.
what do you do after that? Yeah.
So basically, the whole process of wearing a PPE, a personal protective equipment, is called doning, right? So you don into it, and it's a very complicated sort of way we do it. I think there is a video that I put it up on Surgical Diaries of how you don. Right. So what are the things that we wear? I mean, this was done when I was actually in Balapiti in the surgical ward when we had. I think this was during the first wave or the second wave. I can't remember properly, but I remember clearly when it was one of our triforces, where when during the time when the triforces were getting infected, and when they were transporting a quarantine sort of quarantine set of personnels from the Gaul district to Colombo, they had met with a very bad accident. And they were brought to Balapitiya hospital. And as I was a surgical MO there, I had to actually, so there I had made this video of how we do the doning process, right? So the problem is, I think there are so many reasons as to why people keep asking, how do doctors and nurses and all the other staffs still get infected after doning? So just, I mean, sometimes, we do not always have our PPE on because it's not practical to be on a PPE for more than around 10-12 hours, even though I know so many doctors who still have it, who sometimes go at 8 o'clock in the morning and are in the ICU for around until around 12 a.m. the next day. So it's more than 15-16 hours. So because it's very tiring, because you've got layers surgical scrubs, you've got so many other things, and it's very difficult. When you doff, which we call doffing, right? You're basically soaked in your own sweat. It's like you taking a bath in your own sweat. And it's not something, I mean, you all can understand. I mean, I'm sure when you're soaked in sweat, all you want to do is go take a wash, and while you're like that, you still have to work. It's very difficult. But again, we've taken the oath. We've I mean, all doctors who are working in this particular field understand the importance of what they do and the service that they are doing. They still continue to work. But the problem comes in, Inti, when we doff. When we are doffing it, even in US, I know so many doctors who are infected because of the process of doffing. So when you remove, because all of this, what you've worn is contaminated, and when you take it off, there is where you come into contact, there is a process where you can get infected. But now the thing is this: we do not have a lot of personal protective equipment. So the thing that we completely wear, we do not have it all the time. So sometimes there are different protocols in different hospitals on how they actually say a person can be discharged when the person is not infectious, right? And at that particular point, sometimes we do not wear the whole PPE, but we do wear a mask, a KN95 and a face shield, and we have an overall on top of a surgical scrub. We have an overall, we wear our gloves, and then we go to see a patient, so which is more feasible, right? But patients in the ICU HDU, you can't actually go without using a PPE, or even in the isolation wards, because they are highly infectious, right? So infectious as in they have a high propagation potential to give it to someone else. So for those kind of places, we do actually wear a full PP. Otherwise, it's always a partial PP in the ward setting when they're just there, not in isolation. So I think that's what it is, Inti. I think there's a lot of aspects, I think, to be talking about, and you spoke about different things. I think vaccines. Let's just take one thing at a time, Inti. So I think one thing was about vaccination, right? Vaccination is definitely helpful, right? For anyone who thinks it's not, I don't agree, right? Uh, I don't know if this is true, right? I honestly don't know if this is true, but these are things that I overhear. So please don't get offended. Please don't, think that, I am actually trying to pick on any person or any sort of group. I recently had this set of people who said that the amount of Muslims getting vaccinated is less because they think that there is some sort of pork substrate extract which is there in the vaccine. I mean, there isn't anything. So if anyone has said something like that, which is actually wrong, I mean, I know so many countless of people who have got vaccinated. Our community is completely vaccinated. I mean, as far as I know, trying our level best to get everyone vaccinated, because vaccination does save lives. It doesn't give you the 100% protection, but it does reduce the chance of you being able, you getting into a hospital setup. That is one.
I think we've lost Dr. Burhan temporarily. So let's just give him some time until he comes back. This is, guys, a specific, an exclusive. This is an exclusive discussion on how is it to live with COVID. Okay, he's just calling. Let me see. So, guys, Dr. Burhan's he's just experiencing a power failure there, and he's just coming online. So, what we were talking about is actually the aspect of living during COVID. As a medical school, as a medical college, which focuses a lot on healthcare development programs, pre-medicine sciences being taught here. We're also being alerted about students studying a qualification in this part of the year. So anyone who is looking at getting into a medical school is actually going to do one of the most memorable things, not just for today or tomorrow, but the most memorable thing in the entire century. Because you know that a plague of this nature comes once in 100 years. For this century, this is the most devastating issue which the entire world has actually experienced. So the entire world experiencing one pandemic is going to be a rare occasion which actually happens. Okay, this is something which I think is going to be one of the most crucial things. Okay, which just hold on, Christine. Yes, you can just share the first part of the slide. One of the most interesting things is that during a time where people have to be safe, during a time where people have to be careful, during a time where people have to be very conscious, not going out, eating at home, not going out and eating, not traveling out much, not, going out without masks. In a situation like this, what is it to sacrifice your dreams in order to go to a country and study to become a doctor to save people's lives? So this is a very crucial moment that people are respected in their field of medicine, health sciences, nutritionists, psychologists, because it plays a very important psychic role. People who are the support staff, male, female nurses, hospital administrative officers, even people people who are at the area of guarding a hospital is at a risk. Today, going and actually being working in a hospital as a security guard is also at a risk. So the highest risk factor at the moment, if someone asks, is studying marketing at a risk, or studying communication is at a risk, or studying economics is at a risk? The most riskiest thing is studying medicine now. And the International Medical Campus has paved path to more than 120 students just in the last 3 months to study medicine. So the question we want to ask and what people ask us is it worth it? We ask the same question from those practitioners, those future doctors, is it worth it? A pandemic which happens once in 100 years, the medical education supplying divisions have never got so important as of what it has been important now. This is the most important time of what this has actually taken place, the most important time. And the greatest sacrifice which students do will be remembered forever, that you guys have pursued this qualification during a pandemic. So we have Dr. Burhan back. Dr. Burhan, we can continue and we will go into more Q&As. We have your slides ready. You can open your slides, or we also have your slides ready as well here, and you can see what you want to do with it.
Okay. Are you going to be sharing Inti or?
I think probably if you share it, you can navigate it easily. Yes.
Okay. Today is a very bad day, no?
For all of us.
Sorry, Inti, first of all, for actually, promising to do it at 10 and then postponing at 12 and I'm coming on time. Definitely sorry about that. I mean, I actually informed Sumaya also about it. But then, I got the message yesterday that we're having lectures from 10. So I also did not know what to do. So I had to go and then I had promised on another thing for Dana, who's having another session today. I think, okay,
So,
right. How do you share?
first time in 5 years, my laptop also went off, and
Exactly. So,
yeah, I have classes till evening, and I am thinking what to do after this. Yeah,
can't you borrow someone's laptop? Or all your lectures and all are in the laptop,
that's
is
the
it?
whole issue. All my slides are here. Let's see what I can do. Yeah,
So what I do is, Inti, I always leave my stuff
on a
in.
drive.
Yes, exactly. And then it's quite easy. All right. So I hope you guys can see my screen.
Perfect. Yes.
All right. Or is this your screen? My
It's
screen,
now
right?
yours.
Okay.
Yes.
Okay. All right. So basically, Inti, this is you don't want me to do this presentation as a whole. This was actually designed for medical students and people who are actually genuinely properly interested. So I'm not going to take the detail. I mean, not going into details. And this presentation, as you knew, I think we had a session. I think as soon as it started. This was back in 2019, right, when we actually had this session just when it was starting to propagate from when it was becoming an issue. And I think we had our first case, which was a Chinese national who had come on a trip. I'm sure everyone who's here remembers the details, because at that time I was working at Balapiti Hospital, and I remember I got a WhatsApp message of her whole trip shared, as in the day she got out of the airport, and then where she went, where did she go have lunch, which hotel was she at for how many days. And I remember she had actually she was actually boarded at Riu Ahungala, which is close to Balapitia, and all of us had no clue of what this virus does. I mean, yes, we've dealt with MERS, SARS way back, which I have had no experience, right? So I'm sure I'll be talking about what SARS is, what SARS is, what MERS is. This is a brand of coronavirus, but this is a little different because this has this potential of mutating and evolving, unlike any other coronavirus that we've seen, right? So this particular slide, at that time, no one knew what corona was except for this corona beer, right? That is what this is, right? So it started in December 2019, where there were cluster of pneumonia cases, and then finally someone figured out that this is very different compared to the other pneumonia cases that were there. Figured out that this was a sort of a coronavirus. So why it's called a coronavirus? Because of this sort of crown sort of shape that it has, right? And it generally infects two particular tracks, I mean, through particular system, right? It infects the respiratory system, the system that we breathe, and it infects the gastrointestinal system, which is your, your stomach, your esophagus, and that is why patients can develop, apart from developing a cough, a cold, a sore throat, they also can develop diarrhea, vomiting. That is why you get these type of symptoms. I'm sure we had a lot of patients who just had diarrhea and fever, and when they did a PCR, they were tested positive. So, the system, the symptoms that it causes were those two initially, but now we have so many other things. We have patients who come with a rash, right, which is not, with fever. Do a PCR, becomes positive, right? We have patients with a red eye, just a red eye. Do a PCR, they become positive. So there are so many different sort of ways of, ways that it can actually spread. Give me a minute, okay?
So guys, keep your questions ready. You can, you can type it in the screen, and we will check throughout it so that we get ourselves educated.
Alifabin, give me around 30 minutes, I'll call you. No problem. Okay, bye, Alifabin. Okay, so that is why. So these are the type of things that are developing, and that is evolving based on the different variants that are there, right? So as I told you, remember I used these two words, SARS and MERS. So SARS is something that was there in 2003, which is defined as the severe acute respiratory syndrome. That is also is like a form of coronavirus that affected China back in 2003, right? But the thing is, it did cause a lot of deaths, but it eventually subsided, right? It eventually subsided. But with MERS, it was in Saudi Arabia. It killed more people. It had a major mortality rate, but it was for a very short period of time. And eventually, people became immune to the whole aspect of, not developing that many symptoms, right? But now COVID-19 has evolved from so many different variants, right, which I'll be discussing a little later, right? It has become, something which is very, very difficult to treat, right? So again, as you can see, these are the slides which are there. We did not know how it came. I'm sure you also, there was a time where people were watching videos on Facebook and YouTube about what Chinese people would eat. Is it because of that reason, about them consuming different sort of meats? And people, I know a lot of people had their sort of ideas, but still we do not know what is the source, what is the origin, right? MERS is said to come from camels. SARS is supposed to come from civet cats. So we are still not sure. Some people say it's bats. Some people say it's a mix, right? So this spillover has caused that infection to come into humans, right? Again, another slide of this, and how does it spread? Now the question, I think, Inti, you might ask, is this virus a airborne virus or is it a air droplet virus? For people who don't know the difference is a air droplet mechanism is when you cough, right? When you cough, with regard to, or you sneeze, the molecules are very large, and they usually fall down on the ground. But if it's small, it can stay in the environment for a little while. Airborne, if you say airborne, that means it just stays in the environment for a long time. And therefore, for example, if you know a person who is infected and who's coughing, who's sneezing, and he's been in a room for a while, and then when he leaves that room, right, and if you enter that room after even 2 hours, 3 hours, there is a potential. If you classify it airborne, there is a potential that that person can get infected. But still, there is a very thin line between whether it is airborne or air droplet, which we do not know, right? Which we properly do not know. A lot of people, a lot of sources say that the Delta variant is airborne, but we do not have significant evidence to suggest that, or to say no also, right? So it's a sort of a confusing area, or I would call a gray area, but it's better to be safe than sorry, and to actually, take the necessary precautions wherever you go, right? Which is why I always tell all the people who actually call me for advice, I tell them that, right? Again, mechanism of transmission is, breathing, coughing. Contact is also another very important, significant aspect of how you can actually get the virus. Symptoms, there are so many different symptoms. You come with fever, cough, fever, sore throat, fever, blocked nose. Sometimes, you actually come with a headache. Enough fever and a headache, that's enough. Without any other areas of your body has, I mean, not without any other source of infection. So sometimes if you have a fever, does not necessarily mean you have COVID. You might have a UTI, a urinary tract infection, or you might have some other thing as well. But it's always better to, speak to your doctor or someone who you talk to. I mean, SLMA has an amazing service where they have this online consultancy. I don't know if you know about it in Inti. Have you come across it? It's basically the Sri Lankan Medical Association has actually
Is
come
it
up with this
something that
contact
now
number.
I know that the ODOC people are launching certain campaigns also on this. Is it something to
Yeah,
do with
but
that?
then ODOC is a private entity.
Oh,
This is a complete, government run thing. The Sri Lankan Medical Association. It's a group of doctors. Even, any doctor can volunteer. So it's completely free of charge. Let me get you the details. It's basically, I think if I'm not mistaken, the phone number is 1247, right? Hold on. What is the number? Yeah, 247, sorry. 247, right? Just 247. A doctor will pick up, and there are a group of doctors and who will advise you on what needs to be done, what are the things that you need to do, whether you need to start any treatment, they'll properly give it to you. So it is basically in partnership with the health ministry and the SLMA, the Sri Lankan Medical Association. Also, a lot of people ask, what if if someone actually, gets very sick, what do I do? I mean, call 1990, tell that these are the symptoms, they will come and they will do the necessary things that is quite required for you to actually take the patient or whatever. I'm sure Inti has had an experience where he had to actually call 1990 once, and I'm sure it was very, very helpful. So they do an amazing job. Just remember these things. These are things that you can do to help someone else or help yourself, right? And when you have these kind of services, make sure that you use it. Don't just, I mean, if you have your own family physicians that you talk to, always get their opinion. It's very important to get their opinion. So yeah, so if the symptoms persist, they can actually cause a lot of life-threatening symptoms. Like, a person will have like the infection will go into the lungs, and then there is this phase where we call the immune phase, where our own immune system starts attacking our own lungs. And that is why these miraculous drugs that are being publicized in WhatsApp and Facebook these days, which you call tocilizumab, or we call it Tossi, where it is not available in any other pharmacies, come into play. But again, Tossi has its risks. Tossi is basically if there are any medical students out here, or if there are anyone who is in that spectrum, it's basically a monoclonal antibody against interleukin 1, right? So it basically, what it does is, it goes and binds, and it reduces, basically in short, it reduces your immune system way more compared to what a steroid would do, right? That is why a lot of other in the hospitals, we start with something called dexamethasone, which is a steroid that helps to reduce the immune system. It helps to reduce the immune system attacking our own cells, I mean, on lung tissue, right? So that is the basis of that sort of treatment modality, right? So how do we detect it? I'm sure you all know about PCR. We've got random antigen test that is also available, right? So this is how random antigen test works. You get the result in around 30 to 45 minutes, sometimes even less. PCR takes at least a minimum, it takes around 12 to 18 hours. Sometimes you can detect it depending on the machine, right? You've got the RT-PCR, we've got the digital PCR, which is a different thing. So minimum, if you do it in a government setup, it takes around 18 to 24 hours, right? But there are some places where you can do it faster. uh, right? So how is it done? I'm not going to take, this is just a sort of a slide where what a PCR is. I don't think I need to go into that, Tinti. Right, another very important thing, right? A lot of people try to manage themselves, which is very wrong. No point doing repeatedly PCRs. If you have been positive, don't do another PCR for another 3 months. There is a possibility you'll be absolutely okay, and you've got COVID 2 months back and you did a PCR, you might turn positive. Don't worry, the CT value will be very low and very high, right? But you are still considered positive. That doesn't mean that you have an infectious potential. That is why we do not, on discharge, we do not do PCRs. We just do it very clinical. We clinically orient and then only decide whether the patient can be sent home or not, right? Treatment. still there is no particular data about what it can be given, but there are a few things that are given in other countries. Azithromycin is something that is given. Azithromycin is a antibiotic which comes in the macrolide group, but we don't give it. We don't give azithromycin because there is some bacterial infection, but it is proven to reduce the RNA viral load, which is why, sometimes azithromycin is very useful. But again, these data are not completely proven by, the WHO or any other place. It is again country by country deciding on what needs to be given. Dexamethasone has been proven benefit for acute respiratory distress syndrome when the lungs are involved, right? This drug, tocilizumab, right, which is, being publicized all over, considering, some people call it a vaccine, some people call it the miracle drug. Listen, just wanting to let you know that this drug also causes death, right? We've had a few patients, young patients, who we have given it, and now, because we have reduced the immune system so that the immune system does not attack the lungs, the patient is susceptible to secondary bacterial infection, and now the patient is on on septic shock. So, this does not clearly mean that you get this drug, you get better. So that mentality is wrong, right? There is a very fine line for you to, for consultants to decide whether this person needs a drug. Usually, I mean, in Kalubovilla, consultants actually speak. There are multiple consultants who speak with each other, get their opinion, and then decide. Even dexamethasone, increasing the dose, decreasing the dose. Always the chest physician, I mean the intensivist, talk to other consultant physicians and then speak to the respiratory physician and then decide, right? So it's not just done just like this, okay, we start this, we increase this. It's a very complicated, a very gray area, because sometimes increasing the dose or starting something can also cause life-threatening problem. Ivermectin is an antiviral which can be given, right? Hydroxychloroquine and chloroquine is not being given in our country because it is proven to cause a lot of other heart problems and all of the other things, right? So again, the most important thing is prevention, covering your mouth and nose, right? Washing your hands, wearing a mask, a proper mask, not a cloth mask, wearing a K95, right? Sometimes, a lot of people tell you wear a surgical mask and you try to cover the surgical mask. You can wear a surgical mask and a K95. That method is okay. But there's no point of wearing a K95 and another K95 or K9. I mean, a lot of people still wear a K95 with a surgical mask. The whole point is the K95 is enough, right? The surgical mask just helps to, you can't wear a surgical mask on top of that, wear a K95. You need to wear the K95 and then you have to use the surgical mask to make sure that it is properly tucked, right? So that there is no opening. That's the only reason. That's the reason that we want people to wear a double mask. Cloth masks are not at all effective. You can wear it at home, whatever, but they don't have any sort of prevention with regard to this thing. Again, masks, please use it only for the time period. Don't you exceed it, right? A lot of people wear one mask for a month. That is not how it works. Make sure you change your mask, because then the potential of you, I mean, obviously the point of the mask is lost, because there are filters and those filters, stop working after a period of time, right? So that's the whole basis of it. You can't keep using it, right? Don't There are a lot of people who wash the mask. That's not something that you can do. So these things are general things that, I think people should be well aware. I mean, these are very fine points, right? These are very fine points, washing masks and all of that. But it's important. You should know what exactly they are. There are places that, say that, how can we afford masks every day? So, there are people who say, you can actually use a hair dryer and, keep it outside and, blow for around 20 minutes up and down, especially on the blue side if it's a surgical mask in the so I mean, there are a lot of data that says that's not very feasible, but you can only do that for maximum of 3 days. You don't, exceed more than that, right? So I think vaccines, we were speaking about vaccines, right? This is how vaccines, I mean, I don't know if you can see in the, right? Vaccines take so many years for a vaccine to develop. You can see 20 years for SARS. Influenza takes around 11 to 12 years. The California influenza, there are different varieties. Zika, it took such a while for the vaccines to develop. But you can see COVID is something where, we eventually had to, just guess and go ahead with the vaccines because it was becoming such a pandemic, right? So we do not have the significant data to say, okay, these vaccines will, have these kind of long-term aspect of side effects. We do not know. There are a lot of people, call me and ask me, okay, we've been reading these articles that say, if I take this vaccine, I might become subfertile, I might not be able to have kids, I might have some menstrual problems, might have this, I might have that. So I can't say for sure because we have not tested it. But the thing is, at this particular moment, people have to understand, right now, the most important thing is making sure that you survive COVID-19, not about the 20 years down the line. Yes, those are important, but I think at this particular moment, with the death tolls that are actually keeping on increasing, it's quite important that you realize what is the most important thing right now, and you get yourself vaccinated, because vaccination is proven to be beneficial. Yes, there are people who are dying with the vaccine. Yes, I mean, not because of the vaccine, after being vaccinated, coming in the ICUs. Yes, it is very unfortunate. They might have a lot of other comorbidities. They might have a history, and there are those who do not have anything, who have not been diagnosed with any chronic condition and still passing away. Which for that, it is absolutely unfortunate. But statistically, it is still proven to be beneficial. Right? You look at the current data, they say around 98%. I mean, 98.7 or something. Patients who are, vaccinated are not actually getting a hospital admission. It's only around 1 point. So it's a very, very thin line. It's a very thin line. So make sure that you are in that side rather than not being vaccinated, right? So that's pretty much it. I'm not going to, I mean, there are risks of vaccine development, which I'm not going to talk about. There was this thing where, patients can develop thrombosis, which actually causes heart attacks. Right. This is something which is very interesting. These are about the variants that are there. We had the UK variant, the South African variant, the Brazilian variant, the California variant, right? With regard to the mutations that it's causing. Right now, the most dangerous variant that is of question is the Delta variant, right? Which is in Sri Lanka, I think predominantly in Sri Lanka at the moment, especially in the Colombo aspect, where, it's got a very high transmissibility rate, it's got a very high infectious rate, and it has also a very high virulence rate. So all these three important words are very important because of the damage that it does, right? We've got different vaccines. I'm not going to go into that, Inti. We've got the Covishield, which is actually a vector-borne vaccine. We've got the mRNA vaccine, which is Pfizer, Moderna, which is also good. I'm not going to be talking about the vaccination efficacy, which is pointless at this particular point. At this point, if anyone asks me, should I get vaccinated, I say yes. What vaccine? Doesn't matter. Whatever vaccine is available, get the vaccine. Right. But yes, there are people who want to go abroad, who want to actually go to the United States, and those countries actually, want you to be vaccinated with the vaccines that are approved by them, right? But at this particular point, I always say, okay, think about it. If you're here for a year, might as well get vaccinated with whatever that is available, right? That's pretty much it. So there are different. There is this convalescent plasma. I don't know. It's very interesting because I had a colleague of mine who works at US. So basically, he got infected with COVID-19, and then so this was in the initial period. So what they do is, if someone has got infected and has recovered, he has antibodies against COVID. So you can take his plasma and you can actually give it to someone else. And I remember he used to get, just for one donation, he used to get around 1,500 to 2,000 US dollars, just one blood point transfusion, right? So this was something which was very interesting. Sri Lanka has not developed it. We have not done it. Yeah, I think that's pretty much it, I guess. Any other questions?
Cool. So, guys,
This slide goes on. This slide goes on for a long time. I mean, but I don't think there's any point of me going on with it. If there's any questions, we'll talk about it.
Good, sure. There was one question posed, and the question goes as: meeting of doctors at television nowadays told to all people to wash and reuse minimum 5 times a surgical mask. Is it okay? Is there anything like that?
The thing is this, I don't want to disagree completely, right? Because there is no particular proper evidence to suggest that it is useful. Now, if you look at a surgical mask earlier, right? This is what was told. A surgical mask was supposed to be only useful for one-time use, right? You go, that's it. You remove the surgical mask. A K95 initially, this was before everything, okay? K95 was told to actually be used for 3 days, right? So that's 72 hours, but make sure that you hang it outside and all of that. Now the question comes into play is like this, right? Now you go somewhere. This is the scenario that I give everyone. You go somewhere, right? There is a possibility that you've gone somewhere, you met some people, and you worn that mask. So obviously, the mask is going to prevent these small particles or large sort of coronavirus air droplets from entering into your respiratory tract. They are going to be on the outside lining of those masks, right? So you've had it, right? You've had it, and then what people do is they either hang it. Now you wash it. When you wash it, what you're going to do is you're going to damage the filter, right? So it depends on how you wash as well. Now the problem is this. This is why I say some people just leave that mask without washing it. They leave that mask, right? And then sometimes they touch it. They touch the outside part, and then they touch their nose. They sometimes irritate. They scratch their eyes. So obviously, if that coronavirus has been there and they've touched it, obviously they are going to get infected. So this is why I always say, if you can, don't reuse. I mean, especially, and also another thing, if you have just now, for example, you just went outside without any contact, and you just for that purpose, yes, you can. But if you had the exposure, I would not actually recommend it. I mean, there is nothing proven. I mean, doctors will say a lot of things, right? I mean, everything. I mean, we have to understand that there are different things that people can do to reuse a mask, right? But at the end of the day, nothing is proven. But I mean, I always advise. My first advice would be to use a surgical mask only once, and a K95 or a 1995 mask, for maximum 3 days. That's it. That's my advice. You can do the blowing thing, the hair drying thing. That is actually accepted by a lot of countries. But washing would just disrupt the whole this thing. But there is something else. There is this adjustable, filter, which is again a different thing where it has a filter. That is actually good, but I don't know if it is. Then it becomes very expensive, right? So when you look at a mask, how much is a mask? You can get it for around 6 to 5 rupees.
Yeah.
So basically, if you look at it in that way, 6 5 rupees for 30 days, it's only around 150 rupees, right? So I mean, 5 rupees, 30 days, 150. So that's not bad. That's absolutely not bad. So I would still say, I mean, spending 150 rupees and using that 5 rupee mask for around 3 4 days, I would rather spend the 5 rupees. And I mean, I understand there are places where some people can't afford to do it, but 150 rupees isn't expensive. I know so many people who say they can't. They are around 2,000 rupees a day, especially these drug addicts, and they spend around 1,600, 1,700 a day for drugs. So it's a big question, but I would always
And
emphasize
and
on
some
health.
people and some people donate their money for these girls who are dancing in these PUBG games also.
Uh, that's a different topic. I saw the thing that you had shared, and I think that was also on a health sort of a platform, isn't it?
Yeah.
Let's not bring
Anyways,
it up. It's just
Dr.
that
Burhan, there is
every
yeah.
time I've also been I've been sent this for a lot of time, because the thing is, the ward that I work for know that I play PUBG. I also play PUBG, right? And I do follow a lot of people who play PUBG, right? I mean, for me, it's a sort of relief. I mean, I always, medical students also, when I talk to them, I tell them that you don't have to study every day. You need to be relaxed. You can't be constantly studying. You need to have that area where, okay, this is my time, 40 minutes or 30 minutes, I'm just going to relax, play the Xbox. I still play the Xbox. I'm 20, going to be 28, right? I'm 28 years old and I'm still playing my Xbox. Some people will say, what the hell, you're too old to play. But no, it gives me, I get my hand-eye coordination, which I want to emphasize, so that I would be a successful surgeon one day. That is one important thing. And PUBG helps my mind to be a little relaxed, and I don't have any problem. But I do follow people who play, which a lot of people say, why the hell are you doing that, right? But I do that because I learn how they play the game. But people following her for, they're not following her for playing, they're following her for something else, right? She's not playing, she's doing something else, which is the question. So there is like famous, I'll be telling you, there are famous players who go online. There is someone called PG, Thesaurus PG. You can follow him. There's an Indian. She also plays very well, and it's very interesting to watch her play, and then the way that she orients herself. Yeah. Anyway,
Cool. Now the one
more
more
about
question.
COVID-19, Inti.
Yes. Now the one more question. There is an interesting question on a particular student who has put in a comment that he's lost his senses of taste and smell for 10 days. What should he do? Is
So
they asking.
So basically, loss of smell is a very initially, especially when we were dealing with the second wave, it was very common symptom, right? It was more like a pathognomic. What I mean by pathognomic is there are very few things in medicine where you have that, then it's this. You see that this is it. You don't have to do any tests. It's confirmed. It's this, right? So loss of smell with regard to you having a respiratory tract symptom. If you do not have a blocked nose, that's very important. I had a lot of people when I say this, they call me the next day and say I also can't smell, and I ask them whether their nose is blocked. They're like, yeah, my nose is blocked. And I tell them, okay, after doing a steam inhalation, can you smell things? Yeah, yeah, I can smell. It's only when the nose is blocked, I can't actually, I don't have an ability to, smell. So it is considered. A lot of patients had it. The problem is just because you have a loss of smell apart from anything else, don't worry, you're not infectious, right? If you've had it for more than 10 days, the current data that is actually there, they say that if you're having a mild sort of an illness that is considered with a little bit of cough, a little bit of sore throat and a little bit of loss of smell, after 10 days, you don't have to be isolated, right? You can, after 10 days, early it was 14 days, 10 days is enough. That is mild and moderate cases. Severe cases we keep for 14 days, and then there are a lot of other things, technicalities. So after 10 days, you have your loss of smell. Sometimes it can persist for around 2 months. So don't worry about it, but it will eventually get better. You will feel that it is getting better day by day, right? So don't worry about that. It will eventually get better because it involves the olfactory nerve, and eventually, when this whole thing clears out with a good immune system, with a good nutritional support, you're going to get better. But don't worry, just because you have a loss of smell for a long time doesn't mean that you're infectious. Don't worry about it.
Cool. Thank you very much, Dr. Burhan. And just to close off, thank you very much coming on board on your busy schedule, and some couple of things for our students. If you would like to be continuously in touch with Dr. Burhan, there is one way where we conduct a lot of medical training classes, anatomy classes, which you can basically learn a thing or two at his classes. Do register with your counselors, and they will give you regular reminders when the classes are happening. If you are looking at a medical school around the corner for this September or next year, do get in touch with us. Apart from that, follow us on YouTube in order to follow the channels IMC Medical Campus and get all the current updates which is happening with regarding to medical education around you, which will be important to you. So Dr. Burhan, thank you very much once again coming on board and having an interesting chit chat on medicine. Take care, guys. Take care, Dr. Burhan.
Take care, be safe, take care, bye bye.